Hello, dear friends. So I think it's what 10 o'clock in the night or what? I don't know. I'm so sleepy, so tired. आज बहुत थकान हो गया 4 चैप्टर मैंने BCBR का कंटिन्यूसली रपारप पढ़ लिया। पता नहीं मैंने क्या सुन रही थी, क्या पढ़ रही थी, और जैसे जैसे MCQs सॉल्व करती जा रही थी, मतलब half-heartedly, because I do not have any now I don't have any time left. So this is 3 days more, and last 2 days I just have to do MCQs. So I don't know what's going to happen. Anyways, the chapters are very tiring and it's very dry for us. For clinical person, it's very. You give me a appendix, a gallbladder, hernia, hydrocele, fissure, files, fistula, breast lump. Oh God, that is it. It's like this for me, but I can't do all these things. These are, I don't know. These are so difficult, and I don't know what a fool's idea it is. Someone from the community medicine must be sitting and making all these ideas for all of us, that they must be thinking that they are our authorities and we should know something like that. I don't know what are they. Do they do clinical posting? Do they go to the community and see? I don't know. Yeah, I'm not criticizing anyone, but the exam is too much. It's very tiring. I started studying at 7 o'clock, while it's now 10 o'clock. 3 hours studying was too much, and it's too dry of a subject. I'm very happy Sunday it will be over and done with. Whether I pass, I fail, at least I attempted, and I studied with discipline. For the last 1 month, I have been studying with a lot of discipline. So I don't know. I have no idea. Now, do I care now? Okay, I care enough because I have worked hard on it. So if it doesn't happen, it doesn't happen. बहरहाल आज का दिन, आज एक पेशेंट आई थी मेरी, तो फिर शी हैज़ कम आफ्टर so many months. That's what happens. They come to me, then when I tell them surgery, they go to an Ayurvedic person. The Ayurvedic person does give some treatment, then they come back again. Now she has fistula and she needs to get operated. Now that's her call whether she'll get operated or not, because I've told that once you get married, during pregnancy, people will not touch you, because people don't die, because it's high risk for the baby and the mother, and you don't want to subject a person to surgery during pregnancy. इतना हुआ चल के आज बहुत दूर, आज मेरी भगवान से बहुत प्रार्थना थी कि मुझे मेरे प्राइमरी इंस्टीट्यूट में बुला ले। वहाँ पर बहुत दिन से गई नहीं, साइमा वगैरह से मिली नहीं थी, तो आज मिल गई, सपना में गई, बहुत अच्छा लगा। चल के गई बहुत दूर, तो नहीं लगा, लेकिन समय पर पहुँच गई। 10-15 मिनट लेट हुई। आई मस्ट हैव स्टार्टेड अराउंड 12 o'clock. I reached there by 12:40. एंड यूट्यूब बनाते, थोड़ा इधर उधर का यूट्यूब बनाते हुए गई फ्ली मार्केट। अब और जहाँ पर मैं रहती थी वो दिखाई, बचपन का वो रूम, वो गवर्नमेंट कॉलोनी दिखाई, एंड हाउ वी ऑल यूज्ड टू स्टे एज अ फैमिली एंड फ्रेंड्स. आई मीन वी ऑल क्लोज टुगेदर, and how there was a field where all those RSS people would come and do their drills, ding ding ding, whatever drills they would do, and they, or marching they would do, and they would say some कुछ तो बोलते थे जोर जोर से, जैसे विश्राम, आई डोंट नो, समथिंग दे यूज्ड टू से. एंड आई यूज्ड टू बी अ लिटिल गर्ल स्टैंडिंग द balcony and my looking at them, and it used to fascinate me. Anyway, I didn't know that one day it's going to become very big. फिर वो देखती हुई गई, आप लोग को यूट्यूब बनाती हुई गई, घर आई, थोड़ा सोई, थोड़ा खाई. My daughter was very angry with me for some reason, I don't know, and she's gone to a friend's house. She's also in a very fluid state, and she's at the I think she's at the point where she doesn't know what she has to do and where she has to go. 24, at 24 there's nothing like parents. At 24 you have to stand on your own legs. Whether you have to study, you have to do masters, or you have to study and then you have to work and then do master. A lot of people work and then do masters, so that's her choice. Whatever she wants to do, she's free to do. I have nothing to do with it right now. I'm trying to I have to look after her and her finances or whatever she needs. So I'm doing that. I'm trying my level best, and sooner or later I think I will look for a full-time job, because I have been getting lots and lots of offers. I have been refusing because of the private practice, and I'm already attached to one medical college. So sooner or later I might just take a full-time job, because they're really outside Mumbai, where they are offering a very good amount of money as an Arab department. So let me see what happens. But I think I will do it. I miss my days as a teamwork, and I miss teaching students. I miss the adrenaline drive, the fire in the while teaching the students my post graduation, and screaming at them, shouting at them when they are doing the surgeries and making them perfect. And I miss those things. But see, because my students have become big people, and they do all big sort of surgeries, and they're now really masters. It makes me really proud. So maybe before I call it at the end of the day, maybe once more I might just go back again for 2-3 years and then call it a day. Anyway, I love my private practice a lot, and it's one to one. But to convince people in private practice, because they then, when you tell them about surgery, they go to Ayurveda and homeopathy, and I think I don't know anything about Ayurveda and homeopathy, so I cannot talk about anything like. But where surgery is required. So I'm very blunt about that, and if that's their choice, I don't force them. You have to be happy over here. It's they get scared because people around them scare them a lot कि तुम्हारा ये हो जाएगा, वो हो जाएगा, पक जाएगा, पस हो जाएगा, फलाना हो जाएगा, ढिमाका हो जाएगा. I have no answers for these questions. Okay, one is your fate. The doctor does the right work, and you have to go to the right doctors. So for 20 years, my patients have been free of fissure and piles and all, and I don't know that who talks about all these big things about abscesses and things like that. Once in a while it might happen. The more surgeries you do, the more complication rates you get, right? But then I can't. The fear factor is not my domain. It's a psychiatrist's domain. I can just talk to them properly and explain to them. But the anxiety factor has to be dealt. That willpower has to come from them. They have to be positive about surgery to get into surgery. I don't have to convince them. I don't convince people. I tell them that you need a surgery, and you should get a surgery done. Convincing people means I am just forcing them to take them on the table and do it. So I'm not doing that convincing part. They need surgery. They need surgery. I have explained to them very properly. Now it's up to them to decide. Yeah, it's scary. Surgeries are scary. Even daat nikalna is very scary. So I give them benefit of doubt, and they have to. They have full right to become scared of any sort of surgeries. But then you cannot keep on. One disease leads to another. See, if, supposing you have a fissure, it becomes piles. Piles becomes a fistula. Fistula becomes it just multiple fistulas. So it just 1, 2, 3 just keeps on going, because by the time they come to me, they are too late only for the dietary to be controlled by diet, because I've gone to hundreds of people, Ayurveda, homeopathy, this, that before come, because when they come to me, they know that they might land up with surgery. Anyways, it's up to them, and I hope they get they have to come with a positive mind. And these are young girls, and it's very difficult for me to tell them pizza mat khao, burger mat khao, half the things mat khao. It's very disheartening for me to say that. After all, it's everyone is eating it, and I'm taking away lots of food from them, and I'm asking them the conventional food of green vegetables and salads and lots of water. So I feel bad there too, but then what to do? My job is like that. बहरहाल तो और कुछ नहीं हुआ, थोड़ा देर सो गई, पर अभी मैंने 4 चैप्टर किया, बहुत मेंटली एग्जॉस्ट हो गई हूँ. And for some reason my doctor is very angry on me. I don't know what the anger is about, and I hope it settles in, and I hope she settles in, and wherever she gets peace, I hope I don't stop her from getting peace wherever she's gone to a friend's house to stay. So she finds a lot of peace over there. So wherever you're happy and you're peaceful, you can go, as long as you can take care of yourself and not do any sort of wrong things which you will regret in your life. And definitely she's not she's trying to have a foothold in life, and she's दहलीज पे खड़ी है कि क्या करना है क्या नहीं करना है. So yeah, that's a painful period. any transition is a painful period. Change is the only constant, but change is also very, very. It can be very disturbing too. Right from the nest, when the ये फ्लाई करना पड़ता है ना, तो थोड़ा सा तो लगता है. अब ईगल तो अपने बच्चे को बहुत ऊपर ले जाती है, फिर ठाम से गिरा देती है, और बच्चा धीरे धीरे विंग्स अपना फैलाने लगता है. So God, lift us up where we belong, where the eagles fly, on the mountain top, where the penguins grow. I also love this song from an officer and gentleman. I sing very bad, लेकिन मेरा जो मैं गाती हूँ बर्दाश्त कर लीजिए. इसी बात से राम राम. श्री स्वामी समर्थ. प्रणाम. शुभ रात्रि. आपका दिन कैसा गया? मैंने तो पूछना ही भूल गई, मैं तो अपने बारे में ही बात करते रही. सोचती हूँ आपका दिन तो अच्छा ही गया होगा, बेटर देन माइंड. डेफिनेटली आपके बच्चे लोग सब अच्छे होंगे, पढ़ाई लिखाई कर रहे होंगे, एंड आई एम डेफिनेटली, यू मस्ट बी अ बेटर पेरेंट देन व्हाट आई वाज. आई थिंक आई वाज अ शिटी पेरेंट. आई रियली वाज अ शिटी पेरेंट. आई विश आई वाज नेवर अ पेरेंट. Anyways, so आपका दिन अच्छा गया होगा. Now it's a relaxation time. Relax, have a good food, lots of water, and a good rest. Tomorrow is another day and a sunrise. And with this, Shree Swami Samarth, Pranam, Shubh Ratri, and Shabha Khair. Thank you.